Hi, my name is Sarah. I'll be the nurse practitioner doing a neuro exam as well as a musculoskeletal exam here on my patient. So we'll start with the basics, and then as we go through, if you have any questions or concerns or anything that you're worried about, just go ahead and feel free to stop and ask, okay? So let's start with, what's your name?
My name is Sophia.
Okay, Sophia, and what's the date today?
Today is Wednesday, April 19th,
Okay, do you know what year it is?
2023.
Okay, perfect. Where are we right now, Sophia?
We are in Columbiana.
Okay. And what kind of place is this?
This is a house.
All right, awesome. Sophia, why are we here today?
I'm here for my physical exam.
All right, awesome. Sounds great. So I'm going to just go ahead and keep going through some questions here for you. All right, so I'm going to have you just kind of name a couple random items here for me, okay?
Okay.
Can you tell me what this object here is?
A pen.
Pen? Okay. And do you know what this item is here?
That's your name tag.
Okay, awesome. And what about this right here?
Loose leaf paper.
Perfect. Okay, can you repeat after me?
Yes.
No ifs, ands, or buts.
No ifs, ands, or buts.
Okay. And all right, so now I'm gonna have you. I'm gonna ask you to do a couple things, and then I just need you to follow along with the cues that I gave you. Okay.
Okay.
Can I have you close your eyes?
Yeah.
Open your eyes.
Okay.
Close your eyes.
Mhm.
Open your mouth. Close your mouth. Open your eyes. Raise your right hand. Raise your left hand. Raise both hands up to the sky. All right, awesome. Good. You can relax back. So I'm going to write a sentence here for you, and then I want you to read the sentence,
Okay.
and I want you to perform what the sentence says. Okay?
Okay.
So it's going to have an action on here. And I
Read
want
the
you-
sentence out loud?
Yeah.
Okay. Okay, so it says, please close your eyes. So, closing my eyes.
All right, perfect. And then you can go ahead and open. And then I want you to go ahead and write a sentence for me. It can be any sentence, just whatever comes to mind.
Okay.
Clap your hands. All right, awesome. Thank you, Sophia. Okay, so for the next portion of this exam, we're going to kind of run through your cranial nerves. So the first one that I'll be testing is cranial nerve number 1, which is your olfactory nerve, with your sense of smell.
Okay.
I'm gonna have you close your eyes, and
Okay.
I'm gonna place an object in front of you, and I want you to tell me what you smell, okay? You smell it?
Is it a pickle?
Yeah.
Oh.
Okay.
Nice.
Okay, so the second cranial nerve we're going to be testing is cranial nerve number 2, which is your optic cranial nerve.
Mhm.
So I'm going to have you go ahead and cover one eye with your hand.
Okay.
And then I'm going to have you just, can you see all of my face with your
Mhm.
open eye? Okay,
Mhm.
perfect. So I'm going to have raise some fingers. I want you to just tell me how many fingers I'm holding up.
Okay. 2, 2, 2, 2, 1, 3, 4, 3.
Perfect. So I'm going to have you go ahead and switch
Okay.
eyes. I'm going to do the same thing. Are you able to see my full
Mhm.
face?
Yeah.
Okay.
2, 2, 2, 2, 1, 3, 4, 3.
Right, awesome. You can go ahead and relax. Okay, so the next ones are going to be cranial nerves 3, 4, and 6. So the oculomotor, trochlear, and your abducens. So I'm going to have you do a couple things with your eyes first. I'm going to have you just kind of look at me, just kind of noting, looking for any like muscle tremors, anything, nystagmus, anything like that. And I'm going to have you follow my finger.
Mm-hmm.
And then as I'm gonna have you focus on one thing like back behind, and I'm gonna slowly bring my finger in, and I want you to look towards my finger, okay?
Mm-hmm.
Perfect. It is a little bright in here, so I'm gonna have us kind of like relocate so I can assess your pupils a little bit better.
Yeah.
Here we go. So have you go ahead and take a seat there.
Okay.
Bring that down. First, I'm just going to look at your pupil shape and size. Then I'm going to shine some light in your eyes,
Mhm.
okay? Awesome. Nice equal constriction. Then we'll go back on over here. All right, now that we're back on over here, I'm gonna have you close your eyes again.
Okay.
I have a little tissue paper here. I'm gonna just feel your face. I want you to tell me yes whenever you feel it touch you.
Okay. Mm-hmm. Yep. 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 Yep.
All right, awesome. Go ahead and open your eyes. And all right, so the next cranial nerve we're gonna be looking at is cranial nerve number 7, which is your facial nerve. So I'm gonna have you go ahead and kind of wrinkle your forehead and then make a frown. Go ahead and make a funny face for me. Any funny face. Okay, perfect. And then the next I'm gonna have to grab my tuning forks.
Ooh, those are cool.
All right, so I have my tuning forks here. So the next cranial nerve is going to be cranial nerve number 8, which is vestibular-cochlear. So I will bring a tuning fork. I'm going to place it on your ear in 2 different locations, and I want you to tell me either the first or the second which one's louder.
Okay.
Okay?
The first place.
And I'm going to do it over on this side as well.
The first as well.
And then I'm also going to place it on kind of like on the top of your head here, and I want you to tell me if you feel it equally on both sides, okay?
Okay. Yeah.
All right, awesome. So for the next part, I will have you open your mouth. Say Say ah. Awesome. We have nice equal rise, the uvulas, midline. Okay, so that was assessing cranial nerves number 9 and 10, the vagus and the glossopharyngeal. So next we're going to assess cranial nerve number 11, which is your accessory muscle. So I'm going to just kind of hold on your traps right here, and I'm gonna have you shrug your shoulders.
Mm-hmm.
Perfect. Go ahead and relax. And then the last one is going to be the hypoglossal, which is cranial nerve number 12.
Mm-hmm.
So I'm gonna have you stick your tongue out and move your tongue high, up and down. Awesome. Perfect. All right, we have a couple more things to do for the neuro exam. So I'm gonna have you just kind of put your arms up and have you push against me.
Okay.
And I'm gonna have you push down. There we go.
Mm-hmm.
Wonderful. And then I'm gonna have you take your finger to my finger and to your nose.
Mm-hmm.
To the finger, to the nose, and the other hand. Finger, nose, finger, nose. All right, perfect. So next I'm just gonna kind of look at like the tone of your body.
Mm-hmm.
I'm just gonna kind of feel here, just looking, a nice even tone, not really fighting me on anything, nice and relaxed. And then as I move down to the legs, so just go ahead and relax your leg, nice even tone. It drops with gravity. Okay, drops with gravity. And can I have you take your right heel to your left shin and go up and down?
Mm-hmm.
And then same with your left heel to your right shin. Nice up and down. Okay, so our next portion of the exam is going to be assessing your gait. So I'm going to have you just go ahead and walk straight on down here for me. Okay, walk back. And can you walk down on your tippy toes?
Mm-hmm.
And then on your way back, walk back on your heels. And I'm gonna have you stop, turn around. Go ahead, relax your arms at your side,
Mm-hmm.
close your eyes.
Mm-hmm.
And this is gonna just be the Romberg test here. All right, awesome. Ready? Mm-hmm. All right, so I'm gonna have you come on back over and take a seat for me.
Okay.
Let me flip us around here. Got us all flipped around. So next I'm going to do an assessment of your reflexes. So next we're going to do an assessment of your reflexes. I'm going to start with bicep, tricep, then go over you, and bicep, tricep, and go over you. We're going to move on down to knees. Just going to relax your legs. And then we're going to do the ankle here. So I'm going to go right from behind the Achilles tendon. Perfect. Alrighty. I'm going to check the Babinski reflex. I'm going to have you just kind of rest your foot there. And I'm going to go up. Okay. And on this foot. Okay, so this next portion of the exam might be a little uncomfortable. I have just like a fine, like, prick.
Okay.
I just want you to tell me yes if you feel it on you.
Okay. Yep. 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 Mm-hmm. 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 Yep.
You had a cross one.
Mm-hmm. Yep. Yep. Yep.
So now I want you to tell me if you feel equal on both sides.
Yep. Yes. Yep. 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 Mm-hmm. Mm-hmm. Yep. 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 Mm-hmm.
And see your hand here.
Mm-hmm.
And flip forward. Then I want you to tell me if you feel 1 pinprick or 2 pinpricks.
Okay.
So go ahead and keep your eyes closed.
Okay. 1, 2. 1. 1.
Okay. Other hand, please.
1. 1. 1 and 2.
Okay, good. Then I'm gonna do the same thing with your feet.
Okay. 1. 1. 1. 2. Okay. 1. 1. 1. 2.
Alright, so next I'm gonna have you go ahead and put your palm out. I'm going to either draw a number or a letter in the palm of your hand, and I want you to tell me what I drew, okay?
Okay. 5. A.
Perfect. Okay. I'm also going to do another portion of the exam. I'm going to have you close your eyes again, and then I'm going to touch you, and I want you to tell me, like, am I on the right side, left side, arm, leg, where am I at, okay?
Left side of my face. Right arm. Right side of my face. Right leg. Left leg. Left arm. Both arms.
One more thing is, as we go down here, I'm just going to check for the ankle conus. So I'm going to just kind of All right, we are back again for the musculoskeletal portion of the exam. So first, I'm just going to take an overall inspection, just looking at general muscle tone, color, posture, everything like that. She looks like she has a nice even posture, nice tone. And then I'm going to go ahead and take a look at your hand here. First, taking a look at the fingers. I'm just going to kind of palpate the joints, any pain, tenderness. And while I'm palpating, I'm also kind of just looking for any redness, swelling, any inflammation, any abnormal masses, anything like that. Okay, so everything feels good. Pain, tenderness. Pain, tenderness there. Nope. So next, I'm going to have you just kind of fan your fingers out. Bring them into you, down, and up. Not necessarily your wrist, just your fingers. Okay, perfect. Now we'll move on to the wrist. Same thing, just kind of feeling the joints. Looking for any abnormal nodules, anything like that. The wrist movement, I'm going to just have you go up and down. And then side to side there for me. All right, cool. So I'm going to move up to the elbow. Pain, tenderness. Pain, tenderness. Okay. So for the elbow, we're going to go nice up and down. Out. Next, we're going to move over to the shoulder. Okay, just going to feel around. Start at the suprasternal notch. Across the clavicular. Pain, tenderness. Pain, tenderness. Okay. And then for range of motion, I'm going to have you just kind of shrug down. And then you go across your body. And all the way out. And across the body. All the way out. And then I want you to scratch the back of your neck. Go ahead, scratch the other side. And then I want you to reach your hand behind your back and try to reach for your other scapula. Okay, and then go ahead and do that on the other side as well. Perfect. Okay, so as we move on, we're going to just start with the neck and then head to the spine. So I'm just taking another, again, inspection, noting that tracheus midline, noting nice, even, symmetrical neck. I'm just going to kind of palpate. Any pain, tenderness, any complaints in the joints? Okay, so I'm going to have you go ahead and lift your head forward, lift all the way back, lift side, side, and then go ahead and just do one big circle that way and one big circle the other way. Any pain, tenderness, anything, any complaints? All right, awesome. So I'm going to have you kind of spin around. Actually, move the other way so you can see. So just while she's sitting, just kind of noting posture, and then I'm also going to have you stand.
Okay.
We'll move the chair out of the way. Let's see. Oh, this way. Perfect. So we're just going to note like normal curvature of the spine. We have the nice little S. So we go in there. And we are going to start at C7 and then just palpate our way down the spine, noting any pain, tenderness, discomfort. Also, while we are palpating, looking for any lesions, nodules, any signs of infection, inflammation, anything like that. So for this next test, I'm gonna have you kind of bend over, Sophie, kind of reach your toes. We're going to just kind of take a nice look at the curve of the spine, looking for any scoliosis or any abnormalities. I'm going to kind of feel the hips here just to make sure we have even like limb length. Nice even limb length. And then I'm going to have you go ahead and stand up. And we're just going to palpate the muscles in the back. All right, for the next portion of this, I'm going to have us relocate because I'm going to have you lay down while we assess your hips.
Okay.
I'm going to have you take a seat here. Okay. So I'm going to have you go ahead and lay back and lay on your side.
This
Either
way?
one, because we're going to do
Okay.
both hips.
Here, I'll go this way.
Okay. So I'm going to have you relax. Here, I'll give you a pillow.
Oh, there you go.
Okay. So first, again, just inspecting, making sure there's no abnormalities, signs of infection, surgical sites, anything like that. I'm just gonna palpate around the hip joint here. Any pain, tenderness?
No.
A little careful as we go back through where the sciatica's at. Okay. I'm gonna have you go ahead and so we're gonna have you kind of swing your leg forward and swing it back and then lift up and bring it back down. Okay, and then we're gonna have you flip over and I'm gonna do the other side. Okay. Sorry. The same thing. Just palpating any pain, tenderness. Okay, I'm gonna go ahead and swing forward, swing backwards, go up, and all right. You can go ahead and sit up now. Get the back down. But on your back.
Okay, on my back.
Yeah.
Okay.
So I'm gonna have you bend this knee up, and then we're gonna just do up, down, out, in, up, ankle. Okay. Little knee, up, back, in, out. Any pain, tenderness, anything like that?
Nope.
Perfect. Now have you go ahead and sit back up. All right, so that concludes our examination. Sophia, do you have any questions, concerns, anything that I can answer for you? All right, thank you.